All right, good evening, everybody. We're here at Danbury City Hall. This is not unexpected, and we've been prepared for this, well prepared for this. But we have our first case of somebody who works here in Danbury, at Danbury Hospital, who's tested positive for the coronavirus. We've been planning for this for some time. We have all levels of government. Recently we had the Surgeon General here at the federal level. Here we are working closely with Renee Coleman-Mitchell, Public Health, who's been working closely with local departments of public health, and also Danbury Hospital. We have one of the great hospital systems in the country, and if anybody's ready to handle this, it's Danbury Hospital, given the number of emergencies they've had in the past. This person's been identified. She lives in Westchester County, not in Connecticut. She's back into Westchester right now under self-quarantine, self-monitoring. The hospital's been very aggressive. They've gone and they've figured out everybody that she's had any contact with over the last several days. Those folks have been put on furlough, and we're monitoring very carefully. Anybody during that furlough over the course of the 14 days who show any symptoms at all will be immediately tested. Look, this is a virus that is very contagious, spreads fast, not fatal to very, very, very few people. It's going to be like a intense flu season, but we have to be ready, and that's why I'm surrounded by folks right here who know exactly what we ought to be doing. I'm here with Mayor Mark Boughton of Danbury and Harry Rilling of Norwalk, because this person worked at both hospitals, and both are under this strict surveillance right now. With that, I'd like to introduce to you Carrie Eaton. She's the COO of the hospital. Nuvance Health was on top of this.
Hi, good evening. I first want to thank all the local officials, the Department of Health, and all the other public health agencies that have been assisting us. One of the ways we're successful in our communities and keep our communities safe is by partnering and working together, and so we do all appreciate the support. I would like to make sure that everybody knows that Danbury Hospital and Norwalk Hospital, our whole Nuvance Health System has been preparing for a potential COVID-19 infection since mid-January, literally meeting daily, weekly, with multidisciplinary teams, infectious disease experts, logistics experts, emergency preparedness experts, to make sure that our hospitals are prepared to keep our communities and our patients and our employees safe. So I feel very comfortable and confident that we're on the right path to do so. As the governor said, it was somewhat inevitable that there was going to be a positive COVID-19 case in our state, and the first one happened to be an employee who works at our hospitals and is a resident of the state of New York, where we believe the person was infected. We are really working hard back at the hospital. I have teams at Norwalk Hospital and at Danbury Hospital who are currently working to make sure that we identify any and all persons who need to be notified of their potential exposure to this particular person who tested positive. We have physicians sitting at the hospital making those calls, along with other clinical experts. If we identify any persons who have come in contact who have symptoms, we are working with our state departments of health and our clinical experts to make sure we follow all the appropriate guidelines from the expert agencies to keep those people safe, to keep our employees safe, and to keep our communities safe. So I really do feel like we are very well prepared. My biggest message to our community is to remember that we take care of patients with infectious diseases every day of the year in all our hospitals, and our staff know how to take care of patients with infectious diseases, and they're very well prepared to do so to prevent the transmission to other patients and other individuals. So that is what they are doing. That is what they will be focused on. We also want the community to be calm. Honestly, the advice that we're giving that's probably the most important advice is wash your hands really frequently. Make sure you wash them and scrub them for at least 20 seconds. Avoid shaking hands. The elbow bump's become very popular. Don't touch your face because we tend to transmit these viruses to ourselves on our hands and putting our hands on our face. If you feel sick, please don't go to work. Please stay home. And if you have symptoms that are of concern to you, call your primary care physician. As well, the state has hotlines set up for people who don't have, who do not have primary care physicians to find out whether or not they should be seen by a physician or treated any more extensively than just staying home till they feel better. I think, is the most important information I can share with you. Thank you for your support. We will work hard and continue to work hard as we always do to protect our communities and to protect our staff. And thank you again to the public agencies.
Well, thank you for that, Carrie. And very good practical advice. Somebody who's been coordinating the federal, state, and the local response to this virus is Renee Coleman-Mitchell, our Commissioner of Public Health. Renee?
Good evening, everyone. I want to take the opportunity to say, remember we kept saying, it's not a matter of if, it was when, and we all keep saying that. I have to say that we have been working with our healthcare systems and sector for several months now in preparation. And so there's full confidence in what Danbury and Norwalk hospitals will be doing in terms of their incident command and addressing the situation. Our purpose and our role as the Department of Public Health is truly to support what they're doing, to be in a supportive way, to provide technical assistance if needed, and to have our staff down here ensuring that the right procedures and questions can be answered. What I will tell you now is that with our lab, our state public health lab, we have to date 42 specimens that have been tested, 42 specimens. All of those specimens are negative. We have currently 11 in the queue to be tested. And so there's no one, as to date, no positive COVID-19 cases in Connecticut. Keep in mind, this particular case, the source was started in New York. I will also like to say that we do have the 211 hotline that's available for people who do not have symptoms that have just basic questions. The frequently asked questions are going to be posted and available for people to listen to, but also there is a person who can address your questions. Again, that is for individuals who do not have symptoms that want general questions about COVID-19 answered. Thank you. So I also want to inform you that we currently have one kit. One kit provides 600 tests. Our governor has put in writing the request for additional kits to do additional testing. Our goal is to be able to get a kit for early next week that will provide additional 600 tests that can be performed at our state public health lab. We want to also ensure that people who want to be tested can be. Our state lab has a certain capacity, so we're very excited to know that there's commercial labs, LabCorp, Quest Diagnostics, that are on board and being able to test. But we, as a state health department, will be looking to get, hopefully by Monday or Wednesday of next week, an additional kit that will provide additional 600 tests. One kit equals 600 tests. Thank you.
Thank you, Renee. We're expanding our testing capacity every day. And remember, 211, dial that if you have any questions, or ct.gov for all the updated information on this fast-changing situation. With that, I'd like to introduce two of my favorite mayors, Mark Boughton and Harry Rilling, Norwalk and Danbury, both of whom have hospitals on the front line here.
Thank you very much, Governor. It's my honor to be here with my compatriot, Mayor Rilling, and of course with Governor Lamont and Lieutenant Governor Bysowitz. I really can't add much to what's already been said except to thank the Governor's office and his team for being really just ahead of the curve on this all the way through. The Commissioner's been absolutely outstanding in the work that she's done. I want to point out our local health commissioner, Lisa Marcy, who's done an excellent job as well. And if there's a message for the community is that, look, we got this. It's going to be unnerving, it's disruptive, it's scary, but at the end of the day, we're going to be okay if we work together, we follow the protocols that are put in place, and we make sure that we communicate across all lines, including state borders as well. We knew this day would happen. It's here, so we'll manage it. I've been in contact with our superintendent of schools, with our fire chief, with our emergency management director, and of course with Lisa. So we just want to thank everybody for all the hard work that they're doing. And now, here you go, Mayor.
Thank you, Mayor. Again, pretty much everything that I would say has already been said. I'm here with my Director of Health, Dina Diamore. And we have been in touch with the state of Connecticut on a regular basis. We meet on Thursday mornings with our Norwalk Public Schools, our first responders, our EMS, our emergency management. And we make sure that we're getting real-time updated information so we can stay on top of this. And all the things that you've heard about, the protocols, using universal precautions, those are the things you need to do because that's going to minimize the chance that you will contract this COVID-19. So again, I want to thank the Governor's Office, the state of Connecticut. I want to thank all the people that are involved in this because we are on top of it. We are making sure that we're getting real-time information and we want to get information out to the public. But again, we don't want to cause a panic because it should not rise to that level. So thank you. Governor?
Are there any questions?
Did this worker start showing symptoms? Or how did they figure out that they had this? Or was it just something they came in contact with somebody and thought they should get tested?
Yeah, good evening. So we really don't want to give away any patient-specific information. We have to protect patients' privacies. But what we will say is, early on, when the patient was when the individual was identified, they were restricted from their duties. They were tested, and as soon as the test came back positive, it triggered a series of events. But I want to go back to some things that were said earlier because I have to just echo a couple of things. This is not a time to panic. The strokes, the heart attacks, the car accidents continue to come. This will overwhelm our healthcare system if Walking Well present to the emergency department with the expectation of testing. The recommendations, as were mentioned before, until this test is commercially available and readily available, the state is restricting the test to those patients that are acutely ill that require hospitalization. So what we need to do is everybody needs to stay calm, they need to stay educated, they need to be in close contact with their physicians for guidance. Most of the physicians' offices in the state already have triage protocols and they're being enacted daily. This is a very dynamic situation. It's changing not only daily, but essentially hourly. So it informs us as to the next best practices to be implementing in our system. And what we ask to the public is stay educated, stay aware, understand the facts, practice good personal hygiene with hand washing, covering your cough. If you're ill, don't go to work. And those are the things that'll help us get through this a lot faster. We will get through this. We've been through similar situations with SARS and MERS in the past. Danbury has handled situations similar to this in the past, and we come out okay on the other side. So everybody just needs to pull together, stay calm. This is not a time to panic.
Just to kind of follow up, there's no case in Connecticut. I mean, she's back in New York. She was just working here. We don't know if she spread it. I mean, you're tracking it down.
The employee is a resident of New York. She was identified as a person who might have come in contact with another person, and when she was notified that she came in contact with a potential contact for her, she was notified of that. When she was notified of that, she was removed from the workplace to keep people safe until she was tested. We learned her test results came back to us late today, and when her test results came back to us late today, we began to kick in our protocol to notify the appropriate individuals that we had a positive test. So yes, she was in New York. We believe she was infected in New York. When she was notified by the New York public health agencies that she might have had an exposure and that she should be self-quarantined. She self-quarantined, she was removed from the workplace, and then we followed all the protocols. There are really very clear protocols about how to manage each one of these individual exposures, and they were all followed exactly according to the guidance that has been issued by the CDC. As I said before, it's a relatively isolated number of people because this particular individual worked in an isolated geographic area in our hospitals, which is helpful. So it's a limited number of individuals. It would be impossible for me to give you accurate information about the numbers because we have teams right now back determining the positive exposure, the positive exposures, the ones that we're not certain of, and then the ones we're not certain of until we continue to do this investigation. This is a very detailed piece of work we're doing to make sure that we're very, very thorough, and I really don't feel like I can give you a number because it would be a guess, but we believe it is contained because it was a very limited geographic area in both of the hospitals that we are working with.
Was this healthcare worker in contact with a lot of patients or like an office worker? I mean, kind of, or maybe
limited number of patients because of, excuse me?
Was she in both hospitals?
Yes, she was in both hospitals. Yes.
What's the status of both the hospitals? Are they open?
Oh, yes, our hospitals are open. We don't close. We take care of patients 24 hours a day, 7 days a week, and we are very experienced in taking care of patients with infectious conditions such as this infectious conditions. We have many other illnesses in the communities. We're very well prepared to take care of people with infections. And as Dr. Broderick indicated, and we would be able to indicate, Dr. Greenspan would be able to indicate for our Norwalk Emergency Department, we're open for business. We would ask that you go online if you think that you have problems. There's tons of information online about when to seek more detail, seek more care. It's there. Follow those guidelines because we do not want to overburden our health systems with the worried well. We still have lots of sick people in our hospitals and our emergency rooms to take care of.
How long can symptoms of COVID-19 last?
Oh, I'm not an expert. That's a Lori question on the COVID-19.
So once a person becomes ill, usually there's a series of days. Thank you. There's a series of days that the person is symptomatic. Sometimes it can be very mild. Sometimes, as we've heard, it can be more severe. And it will depend on the extent of their illness as to how long it lasts.
I think the reason the 14-day.
Okay. So once you're exposed, the likelihood of developing symptoms will occur within 14 days. Usually it's around day 2 or day 3. And then we will go based on CDC guidelines out to 14 days, limiting any staff member from returning to work as we monitor their symptoms on a daily basis.
At what point are you contagious? Like right away, or do you have to show symptoms?
We assume that so the right away is based on what you're saying as exposure.
Right.
There's a series of days that could occur. Generally, as has been discussed by the CDC experts, and Dr. Fauci, that you really are symptomatic and contagious. Once you become symptomatic, you are contagious at that point.
This woman is in New York now, I know you mentioned, but did she initially self-quarantine in Connecticut? Is that where she realized that she may have been?
She quarantined based on direction from the Department of Health in New York and has not returned to Connecticut since then.
How long ago did she self-quarantine? How many days ago?
Based on the notification that she got, would have been Wednesday the 4th.
And do you know how quickly she self-quarantined after she realized she had been in connection with this person that may have been sick? Was there like a big chunk of time between which?
I believe that was almost the announcement came shortly after the diagnosis of the source patient in Westchester occurred.
So you found out about it on Wednesday?
Just if I might, I wanted to introduce Lori Brentlinger. I didn't do that. She's our expert infectious control practitioner at the hospital. So thank you very much, Lori. I think the questions that you're asking are better suited for the Department of Health in the state of New York because they conducted that investigation and they were the ones in the contact with the employee around asking her to self-quarantine because the exposure was believed to have occurred in New York. So I don't want to answer questions incorrectly that were really conducted in another state.
I'd like to just conclude by saying, not unexpected, we are ready, and I think you can see the professionalism of the people here with us, that we're ready for what may happen. Thanks, everybody.
Thank you.